Good day, dear friends. Today we will talk about a topic that concerns every responsible cat owner: how to recognize pain in our furry friend and understand when our pet needs help. Cats are amazing creatures. They are independent, graceful, and incredibly secretive when it comes to their well-being. Cats are evolutionarily programmed to hide pain and discomfort. In the wild, showing weakness means becoming easy prey or being rejected by fellow creatures. This ancient survival strategy has persisted in domestic cats, making pain recognition a real challenge for us, their owners. Imagine this: your cat may be suffering from severe tooth pain, arthritis, or even a serious internal disease, but continue to eat, groom, and even play as if nothing is happening. According to some data, cats can hide symptoms of illness until the condition becomes critical. That is why it is so important to learn to notice even the slightest changes in the behavior and appearance of your pet. So what signs might indicate that a cat is in pain? Let's examine them in detail, starting with the most obvious and ending with those that are easy to miss. The first and perhaps most obvious sign is vocalization. If your usually quiet cat suddenly starts meowing louder or more frequently, especially when touched or when moving, this could be a signal of pain. Pay attention to the tone of the meowing. A painful cry is usually more piercing, prolonged, or hoarse than normal meowing. Some cats may produce a low, guttural howl or growl when in severe pain. However, not all cats become talkative when in pain. Many, on the contrary, become quieter and try not to attract attention to themselves. Therefore, the absence of unusual sounds does not mean the absence of a problem. The second important sign is changes in behavior. Cats are creatures of habit. They love a certain daily routine and rarely change their habits without reason. If your pet suddenly started avoiding activities they previously enjoyed, for example, stopped jumping onto the windowsill or sofa, refuses to play with favorite toys, or doesn't want to be petted, this may indicate pain. A particularly alarming signal is sudden aggression when touching a certain part of the body. If a usually affectionate cat suddenly hisses, bites, or scratches when you touch, for example, its stomach or back, most likely the touch causes pain. Another worrying sign is a change in social behavior. A sociable cat may become withdrawn, start hiding in secluded places, under the bed, or in the closet. It may avoid contact with other pets or family members. This is a natural reaction. In the wild, an injured or sick animal instinctively seeks shelter to recover or, alas, die alone. On the other hand, some cats, on the contrary, become more clingy, constantly seeking attention and contact with the owner. They may literally follow you around the house, jump on your lap more often than usual, or meow, demanding attention. This too can be a way to communicate a problem. The third sign to pay attention to is changes in movement and postures. A healthy cat moves smoothly and gracefully. Pain can make movements constrained, awkward, or asymmetrical. A cat may limp, favor a certain paw or part of the body, move slower than usual, or with visible tension. Pay attention to how the cat sits or lies down. Unusual postures may indicate discomfort. For example, a cat with abdominal pain may sit hunched over with its hind legs pulled to its chest or lie in a tense posture, often called the prayer position, when the front part of the body is pressed to the floor and the back is raised. Cats with pain in joints or back may avoid certain positions or, conversely, remain in one position for a long time, afraid to move. They may experience difficulties climbing stairs, jumping onto elevated surfaces, or using the litter box. The fourth sign is changes in grooming. Cats are incredibly clean creatures that spend up to 30% of their waking time washing and licking their fur. If a cat has stopped grooming itself, its fur has become dull, disheveled, or tangled. This is a serious cause for concern. However, changes in grooming can manifest differently. Some cats begin to excessively lick a certain part of the body, to such an extent that bald spots or skin irritation appear there. This may indicate pain or discomfort in that area. For example, cats with arthritis often lick painful joints, and cats with skin problems lick itchy areas. The fifth sign is changes in appetite and drinking habits. Pain can significantly affect how and how much your cat eats and drinks. Complete refusal of food is an obvious alarm signal, but also pay attention to more subtle changes. A cat may eat less than usual, eat more slowly, or choose only soft food, avoiding dry food. A particularly alarming sign is pain when chewing. If a cat approaches the food bowl, sniffs, maybe even tries to eat, but then walks away, or eats with visible discomfort. This may indicate problems with teeth or oral cavity. The cat may chew only on one side, drop food from its mouth, or rub its face with its paw after eating. Changes in water consumption are also important. If a cat has started drinking noticeably more or less than usual, this is a reason to see a veterinarian. Excessive thirst can be a sign of serious diseases such as diabetes or kidney disease. The sixth sign is litter box problems. Pain can significantly affect how a cat uses the litter box. If your pet suddenly started urinating or defecating outside the litter box, this may not be an act of mischief, but a signal of a problem. Cats with cystitis or urolithiasis may associate the litter box with pain and start avoiding it. Pay attention to the cat's behavior in the litter box. If it sits there for a long time, strains, meows, or scratches the walls of the litter box with unusual intensity, this may indicate discomfort during urination or defecation. Also, an alarming sign is frequent visits to the litter box with little result or none at all. Check the contents of the litter box. Blood in urine or feces, unusual color or consistency of excretions, too hard or, conversely, liquid stool. All this requires veterinary attention. The seventh sign is changes in appearance. Carefully observe physical changes in your cat. Tumors or bumps, visible wounds or cuts, skin redness, hair loss, change in gum color. Healthy gums should be pink, not white, yellow, or bright red. All this may indicate health problems. Pay attention to the cat's eyes. They should be clear, without discharge. Squinting, excessive blinking, dilated, or conversely, constricted pupils may indicate pain. The third eyelid, which is usually not visible, may become noticeable with some painful conditions. The eighth sign is changes in breathing. A healthy cat breathes evenly and imperceptibly, taking from 20 to 30 breaths per minute at rest. If you notice that your pet's breathing has become more frequent, shallow, or, conversely, too deep, with the participation of abdominal muscles, this may indicate pain or discomfort. A particularly alarming sign is breathing through an open mouth. Unlike dogs, cats almost never breathe with an open mouth unless they are in a state of severe stress or suffering from serious respiratory problems. The ninth sign is changes in weight. Sudden loss or gain of weight without apparent reasons, for example, without changing diet or activity level, may indicate health problems. Regularly weigh your cat, or at least assess its weight by lifting it in your arms. If you notice that the ribs have become more prominent, or conversely, they have become more difficult to feel due to a layer of fat, consult a veterinarian. The 10th sign is changes in sleep. Cats sleep an average of 12 to 16 hours a day, and elderly cats may sleep even more. If your pet has started sleeping noticeably more or less than usual, this may be a sign of discomfort or pain. Pay attention to the positions in which the cat sleeps. If it has stopped sleeping in previously favorite positions or places, often changes position during sleep, looks tense even during rest, this may indicate pain. The 11th sign is changes in play behavior. Healthy cats, especially young ones, love to play. If your pet has suddenly lost interest in games, gets tired quickly, or avoids certain movements during play, this may indicate pain or discomfort. The 12th sign is changes in interaction with the environment. Cats love to explore their territory. Watch what's happening from the window, respond to sounds and movements. If your pet has become less curious, stopped being interested in what's happening around, does not respond to stimuli that previously attracted its attention, this may be a sign that it feels unwell. The 13th sign is changes in purring. Many think that purring always means pleasure, but that's not quite right. Cats can purr from pain too. It's a way of self-soothing. If your cat has started purring in unusual situations, especially when lying still and looking tense, this may be a sign of discomfort. The 14th sign is changes in facial appearance. Cats can demonstrate pain through facial expressions, squinted eyes, tense muscles around the mouth and nose, flattened or pressed ears to the head, dilated pupils. All this may indicate discomfort. And finally, the 15th sign is the owner's intuition. No one knows your cat better than you. If you feel that something is wrong, even if you cannot pinpoint exactly what, trust your intuition. Often owners notice subtle changes in their pet's behavior long before obvious symptoms appear. Now that we have examined the main signs of pain in cats, let's talk about what to do if you notice one or more of these signs. First, and most important, don't panic. Yes, some of the described symptoms may indicate serious problems, but many of them can also be caused by temporary discomfort or stress. Observe your cat. Write down the noticed changes. This will help the veterinarian make an accurate diagnosis. Second, do not self-medicate. Many human medications, even those that seem harmless, can be deadly to cats. For example, paracetamol, acetaminophen, which is contained in many pain relievers for humans, causes severe liver damage in cats and can lead to death even in small doses. Third, consult a veterinarian. If you notice signs of pain in a cat, especially if they persist for more than 24 hours or are accompanied by other alarming symptoms, refusal to eat, labored breathing, lethargy, do not delay a visit to a specialist. Early treatment can not only relieve the pet from suffering, but also save its life. When you arrive at the veterinarian, be prepared to describe in detail all the noticed changes in the behavior and condition of the cat. If possible, record a video of unusual behavior. This can be very useful for diagnosis, especially if during the appointment, the cat, as often happens, does not show symptoms due to stress. Now let's look at some specific situations when a cat may experience pain and how this might manifest. Dental pain is one of the most common problems in cats, especially elderly ones. A cat with sore teeth may eat less than usual, chew only on one side, drop food from its mouth, refuse dry food in favor of wet, rub its face with its paws or against furniture, produce more saliva than usual. The breath may also become more unpleasant. Joint pain or arthritis is another common problem, especially in cats older than 8 years. A cat with arthritis may be reluctant to jump, experience difficulties when climbing or descending stairs, play less, take longer to warm up after sleep, limp, or move stiffly. It may avoid touches to certain parts of the body or react aggressively if you touch a sore joint. Abdominal pain can manifest differently depending on the cause. A cat may lie in an unusual position, pulling its hind legs to its stomach, frequently changing position as if it cannot find a comfortable pose, refusing food, vomiting, or meowing when the stomach is touched. It may visit the litter box more often, or conversely, avoid it due to association with pain. Headache or neurological problems may manifest as unusual head movements, squinting, increased sensitivity to light and sounds. A cat may rub its head against objects, avoid touches to the head or neck, appear disoriented. Ear pain is often accompanied by tilting the head towards the sore ear, frequent head shaking, scratching the ear until wounds appear, an unpleasant smell from the ear, discharge, or redness inside the ear canal. Pain during urination is a very serious problem, especially in male cats. If a cat frequently goes to the litter box but excretes little urine or cannot urinate at all, meows in the litter box, licks the genital area more often than usual, this may be a sign of blockage of the urinary tract, which is an emergency condition and requires immediate veterinary assistance. Special attention should be paid to elderly cats. With age, the risk of developing chronic painful conditions such as arthritis, dental disease, kidney disease, thyroid disease increases significantly. At the same time, elderly cats often hide pain even better than young ones. Regular preventive examinations by a veterinarian become especially important after 7 to 8 years. Also remember that cats of different breeds and temperaments may show pain differently. Some breeds, for example, Siamese cats, are generally more vocal and may loudly communicate their discomfort. Others, for example, Persian cats, may be more stoic and quiet. Knowing the characteristics of your particular cat will help you notice deviations from the norm. What else can be done to help a cat experiencing pain? In addition to consulting a veterinarian, there are several things that can alleviate the pet's condition. Create a calm, quiet environment. Cats experiencing pain are often more sensitive to noise and bustle. Provide your pet with a quiet, comfortable place to rest, away from loud sounds and activity. Provide easy access to food, water, and litter box. If it's difficult for the cat to move, place food and water bowls closer to its favorite resting place. Use a litter box with low sides so that the cat can easily get into it. Maintain a comfortable temperature. Cats experiencing pain, especially from arthritis, often seek warm places. Provide access to sunny windowsills or warm beds. Be attentive to grooming needs. If a cat cannot take care of itself due to pain, help it by carefully combing its fur with a soft brush. Be especially careful with painful areas. Adapt the environment. If a cat has joint problems, provide it with ramps or steps so it can climb to favorite elevated spots without jumping. Soft beds can relieve pressure on sore joints. Use positive reinforcement. Praise and treat the cat when it takes medicine or allows examination of a painful area. This will help reduce stress from medical procedures. and perhaps most importantly, be patient and loving. A cat experiencing pain may become irritable, less affectionate, or even aggressive. Remember that this is not a change in character, but a reaction to discomfort. Give the pet time and space, but be there when you are needed. In conclusion, I would like to say, our cats completely depend on us in matters of health and well-being. They cannot tell us in words that they are in pain, cannot call a doctor themselves or take medicine, but they communicate with us in their own language, the language of behavior, movements, sounds. By learning to understand this language, we can become better protectors and helpers for our furry friends. Regularly observe your cat, pay attention to any changes in its behavior or appearance. Do not ignore even minor symptoms. Remember that early consultation with a veterinarian can not only relieve the pet from suffering, but also save its life. And finally, prevention is always better than treatment. Regular examinations by a veterinarian, proper nutrition, sufficient physical activity, timely vaccination, and treatment for parasites, all this will help your cat stay healthy and happy for many years. I hope this video helped you better understand how to recognize pain in a cat and what to do if you notice alarming signs. If it was helpful, don't forget to like and subscribe to the channel. In the comments, share your experience. Have you encountered situations where your cat was in pain? And how did you determine this? Your stories can help other cat owners be more attentive to their pets. Take care of your furry friends, and until next time.